Ladies and gentlemen, I wish to thank the Royal College of Surgeons for their kind invitation to address the launch of the College's Institute of Global Surgery. It's just over 1 year since the first case of COVID-19 in Ireland. This has been a year which has reminded each of us how our good health depends on the health of others. We are safe when others are safe. That is why I am pleased that global health has been and remains at the centre of the work of Irish Aid. To a large extent, the foundations of the commitment to health lie in the legacy of Irish leadership on HIV and AIDS and on Ebola, as well as our long-standing engagement in partner countries, especially in Africa, with ministries of health. Poverty and poor health are bedfellows. There are many barriers that must be overcome by too many if adequate healthcare is to be accessed. Irish Aid has been working for many years, including its partnership with the RCSI, to systematically enhance access to healthcare, especially through our work and to strengthening health systems. Access to surgery is an integral part of any health system. Despite progress in recent years in reducing child mortality and other primary healthcare indicators, access to safe and effective surgery remains firmly out of reach for many of the poorest people around the world. That access issue is of course no surprise to the Royal College of Surgeons, which for more than a decade has been in partnership with Irish Aid to train and retain surgeons in sub-Saharan Africa. To date, Irish Aid has invested over €5 million in this partnership. Together, we are building local capacity and strengthening governance structures, enabling sustainable improvements in surgical care. In that time, 550 qualified surgeons have graduated from the training programme to date. We are now providing high-quality surgical care to patients in 18 countries in the region. In fact, only last August the programme passed the milestone of 250,000 patient procedures performed by programme trainees in Southern Africa. I'm delighted that Dr. Phyllis Keisha, one of today's conference speakers, is one of the surgeons trained through our partnership. Of course, there can be no safe surgery without safe anaesthesia. Recognising this, last year Irish Aid provided additional funding to facilitate the inclusion of the anaesthesia workforce in this partnership. The partnership with RCSI is part of a broader Irish Aid contribution to global health. Irish embassies in Africa are active in the health sector, often working together with Health Service Executives' Global Health Programme. Irish research partners are playing their part, and Irish NGOs too are working with Irish Aid support to help build health systems, often in challenging circumstances. Indeed, the work of Irish doctors and nurses across Africa over generations has informed our work in health and contributed to our reputation as an effective actor. I'm thinking of the legacy of Dennis Parsons Burkett in Uganda, who developed a treatment for what is now called Burkett's lymphoma, or the contribution of the late Professor Michael Kelly, who died only earlier this year, to the fight against HIV and development of AIDS treatments in Zambia, and many others, some other than some whose contribution have made such a difference. Many, of course, are graduates of this institution. At least 50 million of Irish development funding this year will go to key health partners, such as the Global Fund, the WHO, and COVID-19 response through COVAX and Gavi. This funding will help increase the number of trained healthcare personnel in partner countries, help them deal with the COVID-19 pandemic, as well as the deadly other diseases which kill millions each year. I've also put in place an initiative drawing on materials prepared for health workers here in Ireland to support the mental health of frontline health workers in partner countries. Never before has there been a greater appreciation of the importance of global health. Never before has the global community been so clear-sighted on the need to get the basics right in building safe, effective health systems. The RCSI's global approach to leadership is Irish leadership at its best, and I wish the Institute every success. Thank you.